Hello, I'm Dr. Subur. I'm a consultant medical oncologist and hemato oncologist at Onco Cancer Centres, Hyderabad. In this video, I will be talking about leukemias. What exactly is leukemia? Leukemia is blood cancer which occurs in the bone marrow and lymphatic system of our body. Bone marrow is the site where blood production occurs. So in leukemia, the normal blood cells get transformed into abnormal cancerous cells and they are not regulated in their replication. Because of this, they also hamper the functioning of other normal blood cells around them. What are the types of leukemias? Leukemias can be classified as acute leukemias and chronic leukemias based on the duration of symptoms and how their aggressiveness is. Acute leukemias are again AML, which is acute myeloid leukemia, and ALL, which is acute lymphoblastic leukemia. Among the chronic leukemias, we have CML, which is chronic myeloid leukemia, and CLL, which is chronic lymphocytic leukemia. What are the common signs and symptoms of leukemia? As I mentioned, these abnormal cancer cells of blood cells, they hamper the functioning of the normal blood cells. So accordingly, signs and symptoms can occur. So if there is a fall in hemoglobin because of these cancerous cells, patient can present with fatigue, weakness, lethargy, excessive sleepiness. If there is a fall in the WBC count, one can have a reduction in their immunity, which makes them susceptible to infection. So patient can present with infection, which can occur at unusual locations, fever, and then symptoms pertaining to reduction in platelet count can occur in the form of bleeding manifestations. Now these bleeding manifestations can be in the form of skin rash, which we can see usually as small spots over the hands and legs. It can be the form of nosebleed or bleeding per rectum or bleeding from the gums. So these are the common signs and symptoms of leukemia. What causes leukemia? Let me tell you about the different risk factors for leukemia in general and then specific to each type of leukemia. First and foremost, a genetic predisposition to leukemia can increase risk of one's development of leukemia. Especially children with Down syndrome, they are at an increased risk of development of leukemia. Apart from this, there are certain infections that can predispose to leukemia, such as HIV and HTLV, which is human T-cell lymphocytotropic virus. Apart from this, exposure to certain chemicals such as benzene or exposure to radiation can also predispose one to development of leukemia. Now, if we look at the risk factors for each specific type of leukemia, for AML, especially it was found that exposure to benzene and certain aniline dyes and hair dyes can predispose to development of leukemia, of AML. When it comes to ALL, exposure to radiation and especially if a child who had received chemotherapy for any other type of cancer in their past, they are at an increased risk of development of secondary AML, which we call this as secondary neoplasms. For CML and CLL, we do not have well identified risk factors. However, a war agent, a chemical warfare agent called Agent Orange that was used in World War II was supposed to increase the risk of development of CLL. What are the stages of leukemia? Now, many a times patients ask me what is the stage of their blood cancer. So let me tell you that the staging for leukemias is different from other types of cancers. Now in other types of cancer, we have stage 1, 2, 3 and 4 that is given by the TNM staging or the AJCC system of staging. In leukemia, it is different. We do not have a staging system for leukemia, but we have something called as a risk grouping of leukemia. So based on the risk factors present, we divide leukemias into low risk, intermediate risk and high risk, and each of these different risk grouping categories, they have different outcomes in terms of prognosis. What do parents need to know when they are dealing with leukemia in their children? Now firstly, leukemia is the most common cancer occurring in children and adolescents. Therefore, parents have to be vigilant regarding the signs and symptoms of leukemia that I have mentioned previously in the video. If their child is suffering from any of these symptoms, they need to get it checked with their pediatrician to look for any development of leukemia. Now second, A child who has already history of cancer in the past, who have received chemotherapy for any other types of cancer, the parents have to be vigilant about development of signs and symptoms of leukemia, and they should be on a regular follow-up with their treating doctor so that they can detect early leukemia. Apart from this, parents need to know the prognosis of leukemia and also the adverse effects that are occurring with leukemia. They have to adhere to the protocol that is given by their treating doctor so that the leukemia can be treated well in their children. Can leukemia be prevented? Well, there is no foolproof plan for prevention of leukemia, but we can considerably reduce the risk of development of leukemia. Now, one thing that I had mentioned in the risk factors for leukemia was certain chemical agents. So, reduction in exposure to these agents can to some extent reduce the risk of development of leukemia, especially benzene or hair dyes and other things. Apart from this, children who had a history of any other types of cancer for which they have received chemotherapy in the past, their parents should be on a regular follow-up with the pediatrician or the treating doctor so that they can detect leukemia earlier. What are the treatment options of leukemia? Now, we have come a long way in the treatment of leukemia. So, apart from the conventional cytotoxic chemotherapy agents that we use in treatment of leukemia, we have recent advances such as targeted therapy. Now, in targeted therapy, the treatment that we are giving targets certain specific mutations in the cancer cells which are not present in the normal cells. The prime example that I would give is CML, which is chronic myeloid leukemia, in which we are using only targeted therapy that targets BCR-ABL mutations, and therefore this is a success story in oncology that has resulted in considerably improved survival in treatment of CML. Now, the other treatment options for leukemias are we have certain drugs called monoclonal antibodies. These are the newer ones that again target certain specific mutations in the cancer cells. And then we have bone marrow transplant for treatment of leukemias, for which we require a donor, either a sibling donor or from parents or a matched unrelated donor. This is the ultimate treatment for leukemia. What are the treatment outcomes of leukemia patients? Now again, outcome and prognosis depends on what type of leukemia it is and what is the risk grouping of this particular leukemia. So among the four mentioned leukemias that I have told before, among AML, ALL, CML and CLL, AML, which is acute myeloid leukemia, has the worst prognosis and it has only about 30% 5-year survival rates. When it comes to ALL, it is actually better compared to acute myeloid leukemia, wherein the survival rates can reach up to 60-65%, especially when we have targeted therapies that are available now. And CML, CLL are chronic leukemias. They actually fare well compared to acute leukemias. Their prognosis is better, they have better outcomes. In fact, CML patients can have a normal life expectancy if their disease is in control using targeted therapy, which is called as tyrosine kinase inhibitors. So that's it for today's video. Stay tuned for more information on cancer. Thank you.